Maybe you've done it, maybe your friends or your girlfriends or your wives, your husbands. Botox use is getting very common these days. And some users, if they don't do it the right way, they're getting a sort of immunity almost to Botox. So how does this happen? What other options are there, an alternative to Botox? So joining me now is Dr. Margaret Husami, Medical Director of Derma Health, Skin and Laser. Thank you for being here, Doctor.
Thanks for having me.
Appreciate it. So we talked a little bit earlier. They don't see a total immunity, but if you overdo Botox, there are some issues, correct?
Yes, absolutely. So what can happen is the body's immune system can actually develop neutralizing antibodies to not only necessarily the toxin, but sometimes complexing proteins that are inside certain of those like formulas, such as Botox, Dysport, Jeuveau, have complexing proteins that can elevate that immune response. So what a patient might see is, if they're getting an immunity, is maybe they're not getting as much longevity. Maybe they're not getting that 3 to 4 months anymore for their treatments. Maybe they're coming back at 6 to 8 weeks.
Wow.
Yeah, other times they may be really good about coming in for their 3 to 4 month appointments, but every time we're upping their units, thinking, okay, why are we needing more and more to get that effect?
Right.
Unfortunately, some people will even come in at that 2-week mark when it should be the most effective, and we're not seeing any result.
Oh, wow.
So there are some times that people can become immune. Usually I'm seeing this with people who are doing it for medical reasons, such as migraine treatments, where they're doing upwards of 100 units, say every 10 weeks. So we're introducing that antigen often that the body's immune system will go after it.
Let's talk about what Botox is, because I mean, isn't it like a neurotoxin?
Yes.
Okay, so
Yes.
tell me what it does.
Yeah. So Botox, I will say, it is a botulinum toxin type A. There are a number of formulations. So Botox, Dysport, Jeuveau, they will target acetylcholine, which is just a neurotransmitter, to inhibit that muscle function for about 3 to 4 months.
So basically, it kind of deadens your muscles in different
Exactly.
areas. Because those muscles can create the wrinkles, right? On the
Yes.
forehead and around the eyes and things like that.
Yes.
And that's why that's why so many people like it. It's like the wrinkles kind of go away.
Right, exactly. Yeah, so it's targeting the muscle function. However, it's not necessarily improving the skin. So there are other things that we can do if you're starting to get immune to just enhance that skin quality. Build up collagen, build up elastin to help help fine lines and wrinkles in a different way.
So we got about a minute left. You brought some products here. So what are these? Are these things that you would use instead of Botox?
In combo,
combination?
for
Okay.
sure, yes. And if they're, of course, if someone's not getting results, these are absolutely things that we want them on, but in combination all the time.
Okay, what's this one?
So serums with peptides, ceramides, things that will help firm the skin, help with fine lines and wrinkles, just topical application. This one is an antioxidant serum that protects from that damage that we're getting from internal and external
vitamins
stressors.
and things like that,
Vitamins,
right?
exactly.
Okay.
Pollution and the day-to-day exposure breaks down collagen and elastin.
All right, what's this one?
This is one of my favorite things. All of my patients hear about it is a retinol. Retinol will decrease.
It's been around for a while, right?
It has, yep. Decreases fine lines and wrinkles, helps build up collagen and elastin. Great, easy product. There are some formulations you only need to use twice a week. Others that you can use, like this is gentle enough, you could use every night.
And this is prescription? They have to come see you for this?
These are all medical grade
Okay.
skincare, yes. So
And what about
have
this last one
effectiveness.
here?
And then an SPF. Everyone needs to use a good SPF every day.
Even in the cloudy weather?
Yes, you
Really?
still need it.
I know. I've got spots all over my body. I'm a mess. You're looking at me right now. Dr. Husami, great talking with you.
Yeah, it's great talking
Appreciate
with you
it. Yeah. How can people get a hold of you if they wanted to?
Reach out, Derma Health, Skin and Laser. I'm in our Scottsdale and Arcadia locations, but we have 5 Valley locations.
Great. Well, thank you for coming on.
Thank
Appreciate
you.
it. All right.